Hi, I'm Ralph Bernstein, and I'd like to tell you my story about life and love. I didn't know much about either one when I was young. My life as an adult began when I graduated college and I got a job at a small radio station in New York's Hudson Valley. I was glad to have the job, but I was working long hours for low pay in a town where I didn't know anyone. It was pretty lonely. But then I learned about a local singles group. The first event I went to was a party being held by one of the members in her apartment. Her name was Linda. She greeted me warmly at the door when I arrived. We chatted for a bit. It wasn't love at first sight. I didn't ask her out until a few weeks later. But then we started dating, and we started seeing a lot of each other. We'd go to dinner or a movie. We'd talk about our friends, our families, our jobs. We'd give each other help and advice. We'd been going together about 5 months, and I thought of Linda, and I smiled. And then I realized I smiled every time I thought of her. I wanted to be with her all the time. So I asked her to move in with me. And she said yes. I was delighted. I had this tiny little apartment on top of a store that had always felt too small. But with Linda there, it just seemed right. About a month later, we went window shopping for mattresses. We got home, Linda went in the bathroom, I sat on the bed, and I thought about the fact that every mattress we looked at came with a 10-year guarantee. And I wondered, are we still going to be together in 10 years? And then I realized I couldn't imagine us not being together. I thought, this is long term. You want it to be. Who are you kidding? Linda came out of the bathroom. I took a deep breath and I said, "You want to marry me?" She stopped dead in her tracks, completely startled. And then she said, yes. We were both so happy. Our wedding was a few months later at a catering hall on Long Island near Linda's family. We rented the bridal suite in the neighboring hotel. It was this huge room with a giant bed, red walls, and white trim. After the reception, we were walking down the hall to the room, holding hands and smiling. As we got closer, Linda pulled me toward the room, eager to get there. We got inside, we closed the door, we smiled at each other, and she said, "Turn on the TV." What? "Turn on the TV. It's almost time for the concert." Back then, Linda was a big fan of Frank Sinatra, and that night, he was doing a live concert on television. So I turned on the TV. The picture was a little fuzzy, so I tried to fix it. And for a moment, the picture disappeared. And from the look on Linda's face, I thought the marriage might be ending right then and there. Fortunately, I got the picture back. It wasn't fuzzy. We sat on the bed next to each other. I smiled as I looked at her, and she smiled as she watched television. And so we began our lives together as a young married couple. And I found that I was suddenly part of this big extended family. Linda had all these aunts and uncles and cousins, all of whom lived within driving distance, and they saw each other frequently. This was a new experience for me. I came from a smaller family, and when I was growing up, we didn't live near my relatives, so I rarely saw them. But now we'd constantly be going to a get-together or a pool party or a wedding. One time, we were at this family gathering, and I was sitting on the floor playing with the young children of one of Linda's cousins. And I thought, these are my cousins. This is my family. We'd been married about 5 years when we bought our first house. It was an old colonial that needed some work, so we went shopping together for paint and wallpaper, furniture and fixtures. We didn't always like the same things, but we learned to see things through each other's eyes and to respect each other's opinion. And we took a lot of pride in making that house our own. About a year later, Linda became pregnant. I was thrilled and scared. What did I know about raising kids? Now, Linda was great with kids. Not only did she have experience with the young children of her relatives, but she was a teacher, and a very good one. But she'd never been a parent either, so she was scared too. So we bought books on pregnancy and child care. We turned a room in the house into a nursery. We bought a crib and a rocking chair. We went to a Lamaze class together. And when our daughter was born, it was overwhelming. We were suddenly responsible for this beautiful, helpless baby. I hardly knew how to hold her. But the first time I did, it just felt right. And when I saw Linda holding her, it looked like the most natural thing in the world. She would sit in the rocking chair with our daughter, love in her eyes and a big smile on her face. I smiled as I watched her. And I watched her a lot because she always seemed to know just what to do. I loved and I learned from the little things. Like when she would read our daughter the book, Good Night Moon. Good night room, good night moon. Good night cow jumping over the moon. Good night light and the red balloon. Later, she said to me, it's not just about the book. It's about getting her interested in books and spending quality time together. That became our daughter's favorite book. And you know something? I think I still have it. We did everything as parents, from dance recitals to summer camp. When our daughter was older, teaching her to drive, helping her apply to colleges. We learned the importance of being consistent and of speaking with one voice. And being parents brought the two of us closer together in a way I never would have imagined. And this was despite Linda's fascination with teapots. Linda started collecting teapots. I didn't get it. I mean, teapots? They weren't particularly valuable. And Linda never used them to make tea. They just sat there. But eventually I realized it didn't matter whether I understood. They meant something to her. They were part of who she was. And I loved who she was. So we put the teapots on display. And occasionally, when I was traveling on business, I would buy her another teapot. Linda and I loved traveling together. We went lots of places, and we were looking forward to doing more in the future as we were nearing retirement. One year, we went on a road trip, just the two of us, for 2 weeks along the East Coast. Savannah, Charleston, Hilton Head, the Outer Banks. I remember standing in the pool at this resort in Myrtle Beach, and I was holding Linda in my arms as she floated in the water. It was the last time we did something like that together. The following January, we'd gotten together one weekend with some good friends of ours, and I noticed as we were walking along that Linda had fallen behind. Her leg was bothering her, and she was having difficulty walking. So I took her to this orthopedist we knew. He said that while her leg was bothering her, from her description, he thought the problem might originate in her back. And I thought, okay, maybe it's a pinched nerve. He did a CAT scan of her back, and when we met with him to get the results, he came into the room with this concerned look on his face. He said, "There's something there I don't like." He wasn't sure what it was, and he wanted us to see a specialist he knew, an oncologist. When your doctor tells you there's something he doesn't like, and he wants you to see a cancer specialist, that's when you get scared. So we made an appointment to see the oncologist. We had to wait a week to get in to see him, and during that week, we didn't talk about it. We just ignored the elephant in the room. But every time I looked at Linda, I could see the fear in her eyes. Finally, when we saw him, he said that while cancer was a possibility, he wouldn't know for sure without doing a test. So we had Linda lie face down on the examining table, and he took a small biopsy from her back. Linda squirmed. Linda gasped as he did it, and I was the one who sat there squirming. Then we had to wait another week of pretending everything was fine before we got the results. When we saw him again, he gave us the news. Linda had multiple myeloma. It's a type of blood cancer, but it can also cause tumors. And the problem in her leg was caused by a tumor pressing against her spinal cord. We held hands tightly. It was bad news, but it wasn't hopeless. The doctor said it was treatable, and we were determined to do everything we could to fight it and to win that fight. They started Linda on initial rounds of chemotherapy. I took charge of scheduling Linda's appointments. It wasn't much, but I was glad I could do something to help. And that went on for a few months, and aside from the chemotherapy, we just went about our lives and tried to hold on to some semblance of things being normal. Linda never complained, but whenever I looked at her, I could see she was scared. So I tried to comfort her, to be there for her, act as normal as possible. But I was scared too. I kept thinking, this isn't right. This shouldn't be happening. When will this be over? At first, we didn't tell anyone, except our daughter, who was now living on the West Coast. A colleague at work saw Linda limping, and she said, "Oh, it's nothing." There were times she had to call in sick, and she made up some excuse. She didn't want to be a burden to anyone, and we didn't want people looking at us differently. But over time, we felt we had to start telling people because Linda wasn't getting any better. Those initial rounds of chemotherapy caused some improvement in her blood work, but not the tumor. In fact, it was getting worse. By July 4th weekend, that Saturday morning, Linda woke up and she couldn't walk. She wasn't in pain, but she couldn't walk. I felt helpless. I didn't know what to do. I called the oncologist. He said to meet him at the hospital. And then, after I hung up, I stood there trying to figure out how I was going to get Linda out of the bed, down the stairs, and into our car. I called the local police department. When an officer showed up at the door, he was young and strong looking, and I thought, great, he and I can carry Linda down the stairs. But when I suggested that to her, she gave me a look that said, "Are you kidding me?" I think she had a vision of us dropping her. So the officer called for a paramedic. When he arrived, he took this chair out of his ambulance that had an unusual array of wheels underneath, so you could safely roll it down a flight of stairs without falling over. The two of them got Linda into the chair, down the stairs. They helped me get her into the car. I thanked them and we left. The oncologist was waiting for us at the hospital. He said, "There aren't many emergencies in oncology. This is an emergency." They started Linda on radiation treatments to shrink the tumor. That went on for a couple of months, and eventually they told us it had worked. The tumor was gone. I thought, now we're getting somewhere. Even better, they had Linda undergo a stem cell transplant. They call it a transplant, which makes it sound like surgery. It's not. They do the whole thing through an IV. They take out some of Linda's stem cells, treat her with strong chemotherapy to wipe everything out, then give her the stem cells back to rebuild her immune system. The chemo made Linda feel awful, and it made her hair fall out, although eventually it grew back. Then they just monitored her for a series of weeks, and eventually they told us it worked. The cancer was in remission. We held hands and smiled at each other. We almost cried from relief. The side effects, the misery, they'd all been worth it because it worked. And I thought, we are going to beat this. But Linda still couldn't walk. The tumor was gone, but it had bruised her spinal cord. At first, the oncologists weren't much help. They didn't know how to fix that. But then one of them came up with the idea that we should contact this local rehab facility that specialized in spinal injuries. So I did some research on the place. I identified one of their doctors who sounded good. We made an appointment, went in, and they approved Linda for therapy. That was the first time I realized that I had something important to do. Not just getting her into the rehab facility, but being Linda's advocate, making sure she got all the care she needed. That was something that mattered. She went to the rehab a few times a week. Linda was very popular with the therapists there. She would talk and joke with them, ask them about their own lives. She'd never complained, even when it was difficult. Most of the time when she was there, I waited in the lobby. One time, I wandered back to the therapy area. I saw them helping Linda as she was straining to walk. She saw me, and I said to her, "You gonna be ready for the marathon soon?" "Maybe next week." It was so good to see her smiling again. By the spring, Linda was able to walk with a cane, and she even returned to work part-time, although going to work did make her tired. Linda and I had been talking for a couple of years about the possibility of her retiring. I had already retired, and we were looking forward to when we both were. Sleeping late, eating out, going to the movies, going on cruises, visiting our daughter more often. One day that spring, Linda had come home from work. We were having dinner, and she said, "I think I'm ready to retire." "Okay, why?" "It's not fun anymore." I helped her put in the paperwork. Her colleagues gave her a nice send-off. And on a Friday evening in May, we went out to dinner to celebrate her last day. It was also a victory celebration. We had been through a horrible, frightening year. And now, finally, we could breathe easier and look forward to better times. Then we got a phone call. The oncologist told us that Linda had a particular genetic defect, which increased the risk of the cancer coming back. So even though it was in remission, they wanted her to have another stem cell transplant to prevent a recurrence, but this time with cells from a donor. They didn't do that very often. Most of the time, a patient's own stem cells work just as well. They saved the donor transplants for the high-risk cases. But we weren't particularly worried. Even though the first transplant made Linda feel sick, she came through it all right. And they do have a high rate of success. So the week after Linda retired, she went in the hospital for the donor transplant. They gave her high-dose chemotherapy, followed by the donor cells. The chemo made Linda feel awful. She was unable to do anything except lie in bed. It was hard to see her that way, but it wasn't surprising. But then, after a few days, one of the doctors came to me and said, "Linda's kidneys aren't functioning the way they should. We need your consent to put her on dialysis." That was alarming, though they said there was a good chance her kidneys would recover. But as I signed the consent form, I couldn't help thinking, this shouldn't have happened. When will this be over? I came to the hospital every day, and I had nothing to do. I would sit by Linda's bed all day with the TV on in her room, barely paying attention to it. I felt alone and helpless, just looking for ways to kill time. At night, I'd go home to have some dinner and sleep. We'd moved a few years earlier into a 2-story townhouse, and without Linda, it felt cold and empty. The days dragged into weeks. Linda remained on dialysis. There was no sign of improvement in her kidneys and no sign of improvement in her immune system. It doesn't happen often, but the doctors finally admitted that the transplant had failed. Linda's body simply did not accept the donor's cells. So to rebuild her immune system, they gave her some of her own stem cells, which had been saved from the previous transplant for just this type of problem. Then there were more days and more weeks as Linda very slowly started to improve. At one point, I asked one of the doctors, "When will she be able to come home?" He shook his head and said, "Oh, she's going to need rehab after this." That was the first time I realized how much the chemo had ravaged and weakened her body. I know that chemotherapy is the most effective treatment available today for many types of cancer. But you know something? Chemotherapy sucks. It involves putting toxic chemicals in a patient's body, hoping that the benefits that result will outweigh the problems it causes. And most of the time that happens, but that doesn't change the fact that it's a miserable experience. It makes the patient feel awful. And in a small percentage of cases, it can cause permanent damage. Someday, medical research is going to put an end to chemotherapy through new treatments. And when that happens, we're all going to look back and shake our heads in wonder at what patients were put through. Finally, after more than 10 weeks in the hospital, Linda had improved enough to be transferred. She went to a nursing home that also took short-term patients like her. When she wasn't in her room, she'd be in a wheelchair, either in the dining hall or this community room they had to watch TV or for some kind of entertainment program. I would sit with her. It was a nice place, but we didn't want to be there. 3 times a week, an ambulance would come and take us to the dialysis center. It was like a factory. There were about a dozen stations, each one with a dialysis machine, a recliner, and a small TV. And there was this never-ending routine. They'd bring a patient in, seat them in the recliner, hook them up through an IV to the machine, let the machine clean their blood for a couple of hours with the staff monitoring. And when it was done, unhook them, send them on their way, and bring in the next patient. Every station was full all day long, 6 days a week. The staff there barely had time to breathe. One time, I learned about another patient, a 25-year-old man who died. If he didn't make it, would Linda? I tried not to think about it, but the worry was always there. At the nursing home, Linda was alert enough to feed herself and carry on a conversation. But who could she talk to besides me? And what could she do? She was in an unfamiliar place, in a wheelchair. She didn't know anyone there. She was constantly receiving treatments and medications, and she was on dialysis. She was sad and withdrawn. And I wondered if she'd ever be the outgoing person again she used to be. After 3.5 months in the nursing home, 6 months since the transplant, Linda had enough. She said, "I want to go home." I wanted her home, but I was scared. I saw all the ways she was cared for in that facility, and the idea of having to do all that myself was a little overwhelming. Fortunately, they helped us make all the arrangements. They had a hospital bed with a special air mattress to prevent bed sores delivered to our house. We put it in the living room. It was the only place we had space for it. During the first few months, we had aides and nurses coming to the house to help. It seemed like every day I learned about something new I had to remember or deal with. I was now a caregiver. I had barely known what that meant. I learned quickly. I scheduled Linda's appointments. I dealt with the insurance company and the ambulance company. I rode with her in the ambulance. I was constantly watching her condition to see if there was any change. I shopped and cooked. I sat with her and watched TV. I gave her sponge baths. I changed her diapers. I tried to talk and joke with her as much as I could, but there were a lot of silences. We kept running out of things to talk about. But even without talking, we were there for each other. Either one of us could look up and see the other. And Linda knew that if she needed anything, I would always be there to get it for her. But I was exhausted. Physically, emotionally, I craved a day off. And that made me feel guilty. Linda never got a day off. She couldn't get up and go anywhere or do anything to escape. No matter how hard it was on me, it was harder on her. And that's why, no matter how tired I was, I kept on doing whatever needed to be done. Anything else would have been unthinkable. Aside from the trips in the ambulance, we were stuck at home all the time. It was making us stir crazy. So we decided we had to do something about it. Working with the rehab center where Linda had gone, we were able to get her a power wheelchair. I had a ramp installed in front of the house and a stair lift inside, and I sold Linda's car and replaced it with a wheelchair van, which is actually a minivan with some seats removed and a ramp at it. There were times when people praised me for how I took care of Linda. I was never comfortable with that. I always felt I wasn't doing enough. You see, for me, everything I did was overshadowed by what I couldn't do. I couldn't make her well. I couldn't bring her back to who she'd been before. And I know that wasn't my fault, but that's how I felt. While Linda remained fairly alert, over time, physically, she wasn't getting any better. In fact, she was getting worse. Her hands gradually became very stiff to the point where she couldn't use them anymore. So I was not only cooking for her, I was feeding her. By the time 3 years had passed since the transplant, Linda was still on dialysis. It was clear the damage to her kidneys was permanent. And her cancer history meant that she wasn't a candidate for a kidney transplant. And then I learned something disturbing. 60% of all patients who go on dialysis live no more than 5 years. One evening, I was sitting by Linda's bed. The TV was on and she was dozing. And I looked at her and I thought, she's not going to make it. I saw myself in the house without her, alone and lost. But I knew that she needed me more than ever. And if I couldn't save her, I was going to do everything I could to make her as comfortable as possible. Toward that end, we learned about a different form of dialysis we could do at home. So we eagerly went for the training for that so we could eliminate those exhausting trips to the dialysis center. But once we started doing that at home, there was another problem. Linda lost her appetite. She was barely eating, and nothing the doctors or I did seemed to help. She would lie in bed all the time, barely awake, barely able to speak. I felt she was slipping away from me. Then she developed a slight infection. Between that and the not eating, the doctors had me admit her to the hospital. They started giving her drugs to treat the infection, and they put a feeding tube down her throat. The nutrition from the feeding tube did make her look a little better. She was able to speak and stay alert. First thing she did was ask the nurses if they'd take out the feeding tube, but they told her not yet. Then the surgeons came up with a plan to permanently implant surgically a feeding tube through her body into her stomach. And I was able to explain that to Linda, and she could listen to me and respond to what I was saying. Just being able to have a conversation with her made me feel a little better about how she was doing. Before I left that day, I said to her, "We're going to make you stronger. I'll see you tomorrow." But that night, as I was getting ready for bed, I didn't feel confident. I was determined to keep fighting for her, but it felt like a losing battle. I only felt sadness and despair. Then the phone rang. It was a nurse from the hospital with an urgent tone in her voice, saying that something had happened and I needed to come right away. As I drove to the hospital in a panic, I could hear myself saying, "No, no," over and over. When I got there, they told me that Linda had been hit with a major infection. Her entire body started shutting down. Her heart had stopped. They revived her, but it took a while. And they had to put her on a ventilator. She lay there unconscious, the machine pumping air in and out. But for the moment, she was stable. I sat there overwhelmed, just taking it all in. Then I called our daughter. I don't remember exactly what I said as I told her what happened. I remember she said, "Dad, are you all right?" She told me later I sounded rattled. I stayed a little longer until it became clear nothing further was going to happen that night. Then I went home. Without Linda, the house seemed more empty than ever before. I tossed and turned until I finally dozed off for a few hours. When I came back the next morning, Linda's condition was the same, but she'd been moved to the ICU. I spoke with the attending physician there. He was a kind man who gently explained to me that the prognosis was not good. I said, "I'm trying to decide if I need to get my daughter." "I would," he said. I called her, and as I was explaining the situation, she interrupted me and said, "Dad, do I need to come there?" "Yes, you do." I made a few other calls. I don't remember much about the rest of that day. I remember I stayed at the hospital and went home that night. When I returned the next morning, they said Linda was declining, and they wanted to discuss what to do. I said I wanted them to keep her alive until our daughter arrived that afternoon. I met her at the airport. We hugged tightly for a long time. Then I drove her directly to the hospital. We sat by Linda's bed for a while and then went home. When we talked that night, we agreed we didn't want to prolong her suffering. The next morning, we were about to leave when they called. It was a nurse telling us that Linda was worsening rapidly. I told them we were on our way. When we got there, we went directly to her room. I couldn't help feeling that I'd failed her. I was supposed to keep her from harm. And neither I nor the doctors had been able to do that. And I knew it was time to let her rest in peace. I gave the order to take her off the ventilator. They removed the breathing tube and turn the machine off. At first, nothing much happened. The nurse left us alone and we sat by the bed. Linda was still connected to a monitor, and I could see that her heart rate was gradually slowing down. I have no idea how long it took. I kept staring at the monitor, watching her heart get slower. I couldn't look at my daughter. Neither one of us spoke. And then the line on the monitor went flat, and she was gone. During the few days before the funeral, my daughter and I both kept up brave faces for each other. She's a lot like me. I delivered the eulogy at the funeral. I talked about what Linda meant to people, what family and friends meant to her. I spoke about the unconditional love between her and our daughter. And then I said, it may be a cliche, but Linda truly was my better half, my moral compass. I think what I'll miss most are the ways we made each other laugh. Linda and I had 40 years together. That's a gift. I'm grateful. And Linda will always be a part of me. A few weeks later, I met with the monument company to arrange the headstone on the grave. It's a double stone. Linda's name is on one side. The other side is blank in front of the adjoining plot where one day I'll lie next to her. Until then, I'm keeping busy. I live near my daughter now, and we see each other frequently. I'm traveling. I'm making new friends. I'm even dating. There's a lot going on. So if you'll excuse me, I've got things to do.